Visiting Nurse Association of Ohio has been around for over 100 years.
Back in 1902, we had these pioneering women that wanted to deliver health care and bring it to homes.
I can say the VNA is one of the most committed to their mission and really truly try to incorporate that mission into everything they do every day.
Healthcare in general, and really business in general, is ever changing.
So we had to look at different ways to maximize delivering care while remaining profitable.
Originally, when the VNA first approached us, they were looking for ways to try and reconnect with a lot of their workforce. They were struggling with some of the length of time that it took to get certain activities done.
We had a hard time understanding processes, knowing what standard operating procedures were.
The movement of the patient information through the system to just get the patient seen for an admission to home health required many different departments talking with one another, and that wasn't happening.
As we got through the lean and agile process, we realized there were many opportunities where we could get unstuck.
Everything we do is patient-centered, and sometimes it's hard to remember that when you're shuffling paper.
VNA has utilized other consulting firms to help us with performance improvement initiatives.
They had other consultants come in, so there was a hesitancy there that here we go again, it's the flavor of the day, what's this one going to be like?
I thought that there's no way we have time for this, there's no way that we can get everybody together to actually go through this entire process.
The goal was never to get rid of people, but to repurpose them.
We ended up approximately saving $500,000.
I think it's really huge when you begin to realize how much is really saved outside of just what's the dollar saving, but you look at capacity saving from each person in a team to the number of steps in a process and all that time that you get back.
It took us about 210 steps to get the patient through the system and into our scheduling department. We've cut that over half.
The coaches came in and they just had this amazing personality, and it was fun.
The approach that we take when we work with companies like the VNA really is consistent in terms of the structure that we utilize. However, the actual application of the approach differs from organization to organization.
We were able to structure priorities and initiatives in a visual way, and this made it very powerful because they could see it, and then they could take ownership in it.
The entry-level people as well as the executive-level people could adapt it and make it workable.
I think they've achieved a capability to continually address change as it comes at them and to be able to take advantage of it.
We are able to take these processes and understand that by improving them, we are ultimately improving our patient care.
It really allows for people that might not be noticed in the organization to become noticed. We have found champions in our organization that we would have never found if we didn't hire LeanDog.